Grassroots is an organization that works in particular in a disaster relief environment, but it corresponds to a movement of more sustainable living. In particular, in disaster relief, there can be very little means for incoming groups to connect, or very little opportunity for small or newer groups to launch easily. So we provide infrastructure and any needs that can be met in order to allow these individuals or groups to focus solely on what they came to do. We have had some really interesting opportunities come our way based on just being here and connecting with people. Earlier on, it was very medically oriented. In the emergency phase of the disaster, there's a lot of medicine that gets brought in by organizations to do field hospitals, and a lot of times those organizations bring in their own people, their own materials, their own medicine, and all of the above. And once they're established, there can be a lot of medications that are not necessarily being used, and there isn't the capacity or time for the organization to be able to redistribute stuff that's in excess. So we sat down as a group and discussed a program where we would warehouse excess medical supplies and provide the ability to redistribute that stuff based on assessments of free clinics and connections in the medical community at large. And then as time goes on in a disaster, there's different needs. So originally it was very medically based, and it still is operating today. It was one of the first, if not the first, free medical distribution warehouse that had zero requirements other than being medical professionals in order to receive the goods. There was no red tape that got in the way of that. We're registered with the Ministry of Health. But other than that, we operate based on trust and vetted relationships, as opposed to application processes and other things that'll slow down distribution of goods, especially medication that expires so quickly. The Alternative Building Showcase in our resource center here, the entire property is a place where people can come and use it as office, living, or storage. But more importantly, various alternative building technologies have been built on site, so you can see them side by side, talk to the people that built them, training locals in how to make them, using local materials, having systems on site that are sustainable, composting toilets, as much recycling as possible, building structures out of recycled materials. So our programs are pretty broad at this stage since we've had a year to build them, but they have all grown naturally based on needs that we've seen. The orphanage deworming program in particular was founded after Sam Block's sister passed away last year. He had always envisioned a team that would go out daily and do sanitation-based education for responsibles in orphanages and provide deworming and descabies. So we've been doing that. A few thousand kids in the last 6 months have been dewormed, and the responsibles at the orphanage have gotten sanitation education. And further than that, the orphanages were able to be vetted for sharing their contact information with other groups that come in. An example would be that our orphanage coordinator wanted medical teams to go and do further medical at the orphanages, but we did not have the capacity in particular to be able to provide medical teams, our own medical teams. So I said, yeah, just, it'll come to us, be patient, it'll work out. And a week later, somebody walked in the door saying, I need a list of orphanages because we're doing medical teams. So it's the connectivity that only happens when you're there and you're talking to people. Well, there were rumblings about cholera in general for a few days before the official notice of the epidemic. It was verified, and within 24 hours, Delphine Bedu, who's doing a lot of public health work with us, she translated many documents into Creole and started doing cholera prevention trainings in camps. Within 7 days, we'd seen 43 camps, which represented over 33,000 families. And that was before the UN had met on how they were going to start approaching the problem. We were very proactive when it came to that emergency, and because we're small and because we can move quickly, we were able to get a lot of effective work done. As well as that, we launched a cholera clinic up in the Artibonite region, helping Partners in Health. So they relied heavily on our ability to set up treatment centers up there. Partners in Health is an organization that is in charge of large amounts of medical in Haiti. And we were able to assist them in launching CTCs and bringing doctors and nurses up there to help them as well. And further than that, now we're doing cholera supply distribution 2 treatment centers, as well as Delphine has now launched training of trainers, where we train camp and community leaders in cholera training so that there's no bottleneck at one person teaching these individuals. It's training trainers, testing them, and providing them materials to go out in their own communities and train their own people in how to prevent cholera, considering that there's an epidemic that 700,000 cases are expected in the next 12 months. So the ability to respond quickly to that disaster, being in country and having the connections, is a good example of what occurs when an organization comes solely to be a connecting force as opposed to coming for one specific purpose that's predetermined. Basically, we find places where no one is focusing, and we focus on it until we can collaborate with somebody and continue it. And that goes for a single project all the way up to an entire deployment in a post-disaster country. We jump in, get our hands dirty, do what needs to get done. Don't wait around for people that will prevent any action from taking place. The funding comes when it comes. We all share everything we got and just get it done.